I was an infectious disease epidemiologist. I studied here in EMD, epidemiology of microbial diseases at Yale. And I did studies of vaccine effectiveness and safety until Sandy Hook happened. Right after Sandy Hook happened, which was just a couple of months after I had joined the faculty at the University of Washington, I changed the trajectory or the direction of my work because I was so profoundly affected by it, like many others, that I decided to do something about it. So many people in the public health and medical community feel increasingly that they have a role to play. I have felt even in the past 6 or 7 years that things have been changing. More and more people are getting involved. People are speaking up, and they are sending a very clear message that this is an important public health issue. Violence is a health issue. Gun violence is a health problem, a major leading cause of death in this country, and we need to do something about it. So from my perspective, it's actually a very exciting time to be involved in this type of work. I see the work that my students do. That's part of what I love academia, because in a day-to-day interactions, I learn so much from my students, and that keeps me going. So one concrete example that comes to my mind is the tremendous work done by one of my students in the Department of Epidemiology on issues of safe storage of guns. She wrote a couple of papers, really seminal, influential papers on this topic, and that resulted as part of a body of evidence in some policy change in the Seattle area, in the King County area, in terms of policies for safe storage of guns. So I was able to see firsthand through the work of my student how the evidence that we had generated actually translated into policy in a very short period of time. I would say that public health right now is a very powerful field that's even more powerful than ever. It's a very broad field, as we all know. Regardless of their interest, there are core public health competencies and foundational knowledge items that they need to be really good at. But the flexibility that comes with that provides them with an opportunity during the course of their life to get involved in any other topic that they are interested in, whatever they want to do. Public health is inherently political, so I encourage them to continue to be bold and courageous and speak up for the cause that they care about. There might be always people who may resist against the ideas, against change, against changing status quo, but I think that's what public health students and advocates and practitioners and scholars do. They move the needle, they save lives, and I congratulate students for their choice of public health, and they can all be leaders in the future.